Hello everyone, welcome back to my channel Learn OBG with me. If you have not subscribed my channel, please do subscribe my channel, and if you want to learn more about OBG, please go through my channel, and if you have any doubts, you can write it in the comment section. 27-year-old gravid to para one living one with the 13 weeks of gestation with previous LSES. As per her history, there is no personal or medical or the family history, which is nothing significant. She has walked into the OPD for ANC follow-up and for the NT scan. And when we have performed her NT scan, this is her findings, where we can see in the head of the fetus has an empty, and NT we can see that there is something shadow in the neck. And also the IT is normal, NB is normal, but there's a growth restriction in this scan. And compare while performing the scan, we can also see there is a physiological herniation of the umbilical cord, and you can see the head. There is an empty head, and the brain, the bilateral cerebral hemisphere is absent, which is called as a holoprosencephaly, and we can see that there is a shadow in the NT. And IT we could make out clearly. NB is also made out clearly. But actually, the suspicion where we can be confused with the trisomy 13, but we should be little careful. Respecting maternity, we have given an option of a termination. Patient had undergone a termination where we can see the abnormal fetus with the physiological herniation of the umbilical cord, and also we can see that their hands and the feet are normal. The This is a 12 weeks of gestation, where we can see the size of the baby, and we can see that there is eyes projection of the eyes in the normal nose and the lips of the baby, but we can actually make out the abnormal neck and also the head of the fetus and also the physiological herniation of the umbilical cord, which is actually confused with the trisomy 13. But still, we should not avoid doing a combined test, which is a marker test along with an NT scan, and this is a side view of the fetus where we can see the abnormal head and the neck in this case. So what are the precautions that we should take during the time of a pregnancy? Is first thing is age of the mother, which is very important thing. We have to plan the pregnancy according to the age, and also correct ANC follow-ups should be there. Do not neglect any scan during the time of a pregnancy, particularly the NT scan, the TIFA scan, and the growth scan, which are very important during the time of a pregnancy. And do not avoid to take a folic acid supplementation at least 3 months prior to the pregnancy, and continue this folic acid until 12 weeks of pregnancy without any kind of doubt, because this folic acid will help the neuronal development, and also it will prevent the neural tube defects. So do not neglect the double marker test or the triple marker test, whatever the your obstetrician has been advised, because some chromosomal abnormalities can be detected because of this marker test. And any high risk pregnancy, please listen carefully to your obstetrician advice, and if they are advising any invasive procedures suspicious of anything, that it might be any kind of an abnormality in view of your increased age or anything, do not take a chance and land up in a complicated pregnancies. So choose your pregnancy, be healthy, have a healthy pregnancy, and we wish all the pregnant women to have a wonderful pregnancy journey. And that's all for today. Thank you so much for careful listening.